Hi, my name is Jake Waltzer, and in today's presentation we're going to be covering the endocrine system, which is a system of hormones and other chemical messengers that regulate many of the body's homeostatic processes. So these hormones are regulated through negative feedback, which essentially means that a gland will release a hormone when levels of a certain nutrient or mineral are either too low or too high. And that secretion will cease when the activity of the hormone has brought that level back to an acceptable homeostatic point or within that homeostatic range. So to briefly summarize the types of hormones, let's take a quick look at some of the classes of hormones that are present in our bodies. First, we have our lipid-derived hormones, which are going to be basically our steroids, and they're going to be built from cholesterol. So because these are made from lipids, that means they are lipid soluble, which means that they can easily cross the phospholipid bilayer that makes up the cell membranes in all of our body cells, and therefore they can easily influence that cellular activity. Then we have our amino acid-derived hormones, and we can divide these up into three groups, three different subgroups, and they are, the most basic level is the amine hormones, which are just modified amino acids that contain nitrogen. Then a step in complexity beyond that is a basic peptide hormone, which consists of a short chain of peptide-bonded amino acids. Another step in complexity beyond that is a protein hormone, which is just another way of saying a longer peptide chain. So these amino acid hormones are water-soluble. They are also lipophobic. So unlike those lipid-derived hormones, they cannot easily cross that phospholipid bilayer, and therefore they need carriers in order to get access into the cell and do their work. So all of our amino acid derived hormones need some kind of carrier except for thyroid hormones. And these are a little unique. They can a lot more easily pass through the membrane and attach to intracellular receptors that are present on the DNA. So they can get directly to the nucleus and easily influence cellular metabolism. And here are big players in the endocrine system, and this is essentially the roadmap that we're going to follow as we explore the endocrine system. So up first we're going to have the hypothalamus and pituitary, which the hypothalamus is part of the brain, but it also secretes some hormones, so we include it in the endocrine system as well, and it's very closely linked to the pituitary gland. And we're going to take a really close look at that in a little bit here. Then after that, we're going to get into the thyroid and parathyroid glands, which are obviously very closely related to one another. After that, we have our adrenal glands, regulating a lot of our stress responses. Pancreas, most people are very familiar with the pancreas, at least to some extent. Pretty much everyone has heard of diabetes, insulin. Everyone has heard about that to some extent. We're going to get a little more in depth than most people have probably been made aware that what the pancreas can do, because it can do a lot of different things. Finally, the pineal gland is kind of a small gland. It doesn't do a lot. As far as we know, it only really secretes melatonin. And then I don't have it on here, but there's also some secondary endocrine organs that we're going to take a quick look at towards the end, because not only these glands create hormones, there are other parts of our body that secrete something in some way, and they might just be an intermediate, such as in the skin, producing cholecalciferol when exposed to UV light, which is just an intermediate in our D3 production. And that's a very important process, but it all starts in the skin, which we typically wouldn't think of as part of the endocrine system, but it actually is. So, to start our exploration, let's look into the pituitary gland and the hypothalamus. To continue our discussion of the endocrine system, we're going to introduce the pituitary gland and the hypothalamus. So both of these organs reside within the cranium as part of the brain. The hypothalamus is anterior and inferior to the thalamus within the diencephalon. And the pituitary gland is just below, which is pictured right here. And it's just inferior to the hypothalamus. And they kind of work in tandem to regulate a lot of the body's processes. And at that hypothalamus, that is kind of the connecting point or the bridge between the nervous system and the endocrine system. So the pituitary gland, small double-lobed gland, you got an anterior and a posterior lobe to this particular gland, and they're connected by the infundibulum. And that allows certain hormones that are created within the hypothalamus to come down and be secreted by this posterior lobe. Because this posterior lobe does not make any of its own hormones, it only stores them after they've been created and brought down from the hypothalamus. So within this infundibulum is the hypothalamic hypophyseal tract, which is the actual channel that those hormones go down through. So overall, the pituitary gland secretes around 9 different hormones that have a really big range of impacts on the body and how it develops. So in this pituitary lobe, as I've said just before, it does not secrete any of its own hormones. Rather, neurohormones arrive through the infundibulum, fully assembled and ready to go. And these are oxytocin, an antidiuretic hormone, sometimes called vasopressin, and these are really vastly different hormones. Oxytocin has a couple of different effects, and it's involved in breastfeeding, bonding between parent and offspring. It's a good part of the love feeling that we get, attachment, couple bonding. And meanwhile, on the other hand, we have antidiuretic hormone, and this is completely different. It stimulates the kidneys to reabsorb water instead of passing it through urine, which helps to keep us from getting dehydrated. And some people call it vasopressin because it impacts blood flow. It causes vasoconstriction, so those blood vessels are tightening up a little bit, and that increases blood pressure and drives it up. Meanwhile, the anterior lobe secretes 6 different hormones, and it makes them on its own rather than receiving them from the hypothalamus. So briefly, let's just go over a summary of these different hormones. We have thyroid-stimulating hormone, which stimulates the thyroid to release its own hormones. And we're going to take a look at the thyroid in just a minute here. Next, we have adrenocorticotropic hormone, which stimulates the release of corticosteroids from the adrenal cortex. Next, we have follicle-stimulating hormone and luteinizing hormone. And these both stimulate the gonads for production of gamete cells, which are going to be our sperm and ova, and for the production of androgens as well. And also, luteinizing hormone helps to regulate menstrual cycle in females. Growth hormone, a lot of people have heard of growth hormone. It does exactly what it sounds like. It controls growth. Overall growth of body tissues, including muscle and bone. Then lastly, we have prolactin, which is really just involved in breastfeeding, milk production. It helps to prepare the female body for the birthing process, develop the mammary glands a little bit, and essentially just assist with pregnancy and childbirth. We also have in the middle here, in the intermediate zone, it produces melanocyte stimulating hormone, which is something that does exactly what it sounds like, stimulates melanocytes to produce melanin. This is kind of a weird hormone because what's been seen is that people with darker skin, obviously higher melanin content, seem to have pretty much the same levels of melanocyte stimulating hormone as people with more fair, light-colored skin. So clearly, these are all very important hormones for regulating a lot of what the rest of the endocrine system does. So as such, disorders in the hypothalamus or the pituitary gland can have really significant impacts on how the body develops. So since growth hormone is a major determinant for the overall growth of the body, any overproduction of this hormone can lead to a condition that is called gigantism, where essentially there's just way too much growth hormone, the body grows way too much, way too fast, which sounds like it might be a good thing. You end up being really tall, maybe have a lot of extra muscle, sounds like it would be good, but but can actually lead to a lot of health problems because the growth is just too rapid to support. Then on the flip side, an underproduction of growth hormone can lead to something known as pituitary dwarfism, where that deficiency of growth hormone causes the body to really be limited in how much it can grow. So if you have pituitary dwarfism, you're going to have a very small stature, be very short, and have some strange growth patterns with the joints and the bones. So we can see there's going to be some kind of abnormal growth, not going to be quite built as most normal growth patterns would dictate. So next in our discussion of the endocrine system is the thyroid gland, which is located anterior to the trachea and inferior to the larynx within the neck. So it's pictured right here in red. It's got these two wings that are joined in the middle by the isthmus, and it's anterior or just in front of the trachea, pictured in green here. So both of these wings are composed of thyroid follicles, which contain colloid in their central cavity. And that is where the hormones are actually made. So these hormones are dependent upon iodine for their formation, and the gland is triggered into action when thyroid-stimulating hormone from the anterior pituitary, which we just discussed, binds to receptors within the follicles, which triggers active transport of iodide molecules into the cytosol. So iodide is the actual element, and it's got a -1 charge. So when the iodide molecules move into the lumen of the follicle cells, they get oxidized, where the negatively charged electrons are removed, and then that iodide can be converted into iodine, which is I2. So pictured right here, it's going into the actual formation of the hormones. So once it's been converted into iodine in the colloid, peroxidase enzymes can take that iodine and attach the molecules to the amino acid tyrosine. And that produces two different thyroid hormones. The first one, T4, is called tetraiodothyronine, and it's not quite as potent as its counterpart T3, which is triiodothyronine. These hormones remain in the colloid until thyroid secreting hormone triggers the exocytosis of the thyroid hormones, which must remain bound to a protein carrier called thyroxine binding globulin. And that's just because even though they are amino acid derived hormones, they can actually cross that phospholipid bilayer very easily. So to prevent the hormones from just freely entering cells, it binds to the thyroxine binding globulin to actually prevent it from just entering cells constantly. So the effect of both of these hormones is to increase nutrient uptake and the oxygen use of cells that gets used for the breakdown of ATP, which is how our mitochondria obtain their energy. So this is a calorogenic effect, which increases energy usage, and also thermogenic, which increases our heat output and causes our body to heat up. So low levels of thyroid hormone in the blood will trigger the hypothalamus to secrete thyrotropin-releasing hormone. That further triggers the release of thyroid-stimulating hormone from the anterior pituitary. So this, in turn, will activate the thyroid to do what it does and produce T3 and T4, which thereby will increase our cellular nutrient breakdown. So on top of just producing thyroid hormones, the thyroid will also produce calcitonin, which is an intermediate in the process of vitamin D production. So calcitonin is produced in the parafollicular cells of the thyroid gland, and it functions to increase the activity of osteoblasts and to decrease the absorption of calcium within the intestine. This, in turn, will reduce blood calcium levels. So there are two main disorders that are associated with the thyroid gland: hypo and hyperthyroidism. Additionally, an iodine deficiency can cause issues with the thyroid gland, as it's a very important nutrient, or mineral rather, for the synthesis of T3 and T4. So a lack of iodine will lead to an excess of thyroid-stimulating hormone, and since that hormone can't actually get produced, it just keeps building up and leads to excessive deposits of colloid within the glands, and that creates a big abnormal abscess essentially, which is known as a goiter. So the thyroid just gets swelled up with all this extra colloid fluid, and that can cause some problems. And then with hypothyroidism, the gland will become inflamed. There's a couple different ways that it can be caused, but it'll become inflamed and underproduce T3 and T4, which can lead to a lot of different negative effects on the body, and it's very widespread. So there'll be a low basal metabolic rate, which will lead to weight gain, and very low body temperature. And this can also impact mental faculties, leading to kind of slow thought, sluggish feelings. And on the other hand, hyperthyroidism is exactly the opposite. There's an overabundance of activity with the thyroid gland, and there's obviously going to be excessive thyroid hormones, which can lead to an inability to gain weight, excessive body heat, constant sweating. And there's a couple of different ways that this can be treated. There's a thyroidectomy, which can be the complete surgical removal or partial surgical removal of the thyroid gland, which will reduce or eliminate the secretion of those thyroid hormones. So following the thyroid gland is the parathyroid glands, which reside on the posterior aspect of the thyroid gland itself. So here, since the thyroid gland resides on the anterior side of the trachea, now we can no longer see the isthmus. We only see the trachea and then just the two lateral wings. So generally, there are 4 of these glands, here, 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 and here. Although it is known for extra parathyroid tissue to develop within the neck and chest, and this typically presents no harm to the individual. The thyroid glands are composed of oxyphil cells that don't really have a clear function, as well as chief cells. And those are the cells that actually produce the parathyroid hormone. So this is a peptide hormone that is released in response to low blood calcium concentrations, and it goes on to increase the activity and proliferation of osteoclasts, and that simultaneously will inhibit the activity of osteoblasts. So it's going to increase the activity of the cells that destroy bone to release calcium and inhibit the activity of the cells that build bone. So that way we're getting osteoclasts to release that calcium into the blood, as well as phosphates released into the blood at the expense of osseous tissue. So that's going to decrease our bone density, increase our blood calcium levels. So parathyroid hormone will also influence the kidneys, and they do that by inhibiting the production of calcitriol, while also causing the kidney tubules to retain calcium as well as magnesium instead of passing it through as urine, which will further prevent the loss of those minerals. So in essence, the parathyroid hormone is key in maintaining proper levels of minerals in the body, such as phosphates, magnesium, and primarily calcium. So there are 2 main disorders that are associated with this gland, similar to the thyroid gland: hyperparathyroidism and hypoparathyroidism. So hyperparathyroidism is characterized by an overproduction of parathyroid hormone, which, given what we just learned, will obviously increase the amount of catabolism on the bone tissue. So this will cause the bones to become very thin and brittle, so there's going to be a higher risk of fracture and breaks, and the calcium released from bone tissue will also alter the balance of our calcium and sodium, which is very important in maintaining our ability of the sodium-potassium pump and everything like that. So it'll decrease the ability of our nervous system to use those ions to send signals, as well as decrease the ability of our muscular system to actually contract our muscles and do work. So the main treatment for hyperparathyroidism is a parathyroidectomy, similar to using a thyroidectomy for hyperthyroidism. So this is, again, the partial or complete surgical removal of excessive parathyroid tissue to decrease the amount of parathyroid hormone that is actually being secreted. Meanwhile, hypoparathyroidism is exactly the opposite. So the parathyroid gland will not be secreting enough of that parathyroid hormone, and that will thereby cause calcium levels to drop too low. So because of this, there will be an excess of sodium, leading to excessive amounts of sodium entering the cells. So there's going to be, again, an excessive amount of activity in the nervous system and the muscle system that can cause spasms, convulsions, and in severe cases it can even cause paralysis, which can actually end up becoming fatal if certain muscles associated with breathing, like the diaphragm or intercostal muscles in the ribs, if you can't breathe, obviously you cannot live. So typically, something like that will be caused by a genetic abnormality or an autoimmune disease that is attacking the parathyroid gland, so it can no longer produce its hormone. And the most common treatment for this is supplementing with activated D3 as well as calcium. So just manually increasing the levels of those minerals in the blood rather than relying on the hormones to do it for us. So next we have the adrenal glands, which are wedge-shaped neuroendocrine structures that are attached superiorly to the kidneys by a fibrous capsule, which is this red structure surrounding the adrenal gland right here. So they're privileged to a very high blood supply directly from the aorta, and that is due to the suprarenal and renal arteries. So we've got these 3 suprarenal and 1 renal artery, which feeds the kidney but also shoots up to feed the adrenal gland. So this allows blood to enter into the adrenal cortex, which is this purple structure, and then that drains down into the adrenal medulla right here in the middle, which is this black structure. So adrenal hormones are then able to enter systemic circulation with the left and right suprarenal veins, and they're a key component of the hypothalamic pituitary adrenal axis, or the HPA axis, which regulates cortisol and other lipid-derived steroid hormones in response to our stresses. So these hormones will go on to influence many activities within the body, such as blood pressure, blood volume, nutrient uptake, electrolyte balance, as well as our inflammatory responses to injuries. So the adrenal glands are separated into 2 main divisions, the adrenal cortex and the adrenal medulla. So first, let's examine the functions of the adrenal cortex. So I have the basic outline of the adrenal cortex right here. This is the entire adrenal gland, including the medulla, but we have our fibrous capsule up top, along with the 3 different zones of the cortex on top of the medulla. So another part of the HPA axis, the hypothalamus, will release adrenocorticotropic hormone, which will go on to stimulate the adrenal cortex to produce its corticosteroids. So then these corticosteroids can be further divided into 2 subdivisions, the mineralocorticoids and the glucocorticoids, which are produced in different sections of the cortex. So let's take a quick closer look at these hormones. So the most superior section of the adrenal cortex is the zona glomerulosa, and that is where we are going to produce our mineralocorticoids. So these are hormones that influence the concentration of minerals within the blood, which thereby will ensure that the body has all of the necessary ions and building blocks to power its nerve signals and to build tissue. So the main mineralocorticoid that we're mostly going to be concerned with is aldosterone, which is a participant in the renin-angiotensin-aldosterone system, and this hormone will increase the concentration of sodium ions in the blood, while also causing excess potassium to be excreted in sweat. So this helps to maintain that balance of sodium and potassium ions, which kind of ties back into the sodium-potassium pump, again very important for the nervous system, as well as the contraction of muscle fibers. So additionally, aldosterone will increase our blood volume, thereby increasing blood pressure, and this will contribute to a healthy circulatory system. So to better understand the renin-angiotensin-aldosterone system, let's just take a quick look at the pathways and the end functions of this particular system. So there's going to be specialized cells in the kidneys that secrete an enzyme called renin, and that is in response to low blood pressure and or low blood volume. And renin will catalyze the conversion of angiotensinogen produced in the liver to angiotensin 1. and that circulates up to the lungs to be converted into angiotensin II by angiotensin converting enzyme. So angiotensin II has a few different functions, which includes inhibiting vasoconstriction, as well as stimulating the kidney tubules to retain sodium and water instead of passing it through as urine. But its most important action is to stimulate the release of aldosterone in that zona glomerulosa of the adrenal cortex. So therefore, the end result of activation of the renin-angiotensin-aldosterone pathway is to increase our fluid retention and thereby increase blood pressure and blood volume. So going one more zone deeper into the cortex is the zona fasciculata, which secretes glucocorticoids, and that goes to regulate glucose metabolism in the body, ensuring that we have adequate fuel for all of our bodily functions. So by far the most important of these glucocorticoids is cortisol, which acts to trigger catabolism of proteins as well as triglycerides into their component amino acids, which is fatty acids and glycerol. And these are going to go towards the synthesis of new glucose. So additionally, cortisol will downregulate immune responses, which helps to reduce inflammation when injured. This is why sometimes athletes, if they tear a ligament or get another severe injury, they will get a cortisol shot to reduce that inflammation and really downregulate that pain. So generally speaking, this group of corticosteroids will cause very widespread catabolism in order to get the building blocks like amino acids and fatty acids to synthesize glucose, and will also inhibit the growth of new body tissues in order to reserve those building molecules for glucose synthesis. So additionally, or clearly, this is an important function for periods of stress, while maintenance of body tissues is less important than getting adequate glucose for fuel. So when we're really stressed out, when we're in like a fight or flight type of situation, we're not too worried about building up big strong muscles. We're worried about getting enough fuel as quickly as possible to do whatever it is that our body needs to do to either fight or run away. So an interesting note is that the hippocampus, which is part of the brain, very crucial component of learning and memory formation, is very sensitive to even small changes in glucocorticoid levels, as it has very many glucocorticoid receptors. So high levels of stress may negatively impact the brain's ability to form and store memories during these times of stress. So the deepest component of the cortex is the zona reticularis, and this region produces small amounts of androgens in response to stimulation from that adrenocorticotropic hormone, and this supplements the gonadal production of these hormones by converting that adrenocorticotropic hormone into testosterone and estrogens. So in males, this is pretty insignificant. We're not going to get that much benefit out of this conversion into testosterone, but this is pretty much as the maximum amount of androgen production for women who are postmenopausal. So now that we understand what the cortex does and its functions, we can examine the other component of the adrenal gland, which is the adrenal medulla. So the adrenal medulla will secrete entirely different hormones that are really actually neurotransmitters, and these are derived from the amino acid tyrosine. The adrenal medulla is going to be structurally different from the cortex, and it's composed of postganglionic sympathetic nerve fibers, and instead of producing steroid hormones, it has chromaffin cells that secrete two different types of catecholamines. And these are epinephrine and then its less effective counterpart, norepinephrine. So both of these hormones trigger the body to convert glycogen into glucose, which gives the body a very quick increase in energy during times of fight or flight. And their secretion is triggered by the hypothalamus through that SAM pathway. So there's a couple different disorders that can be associated with this gland. Addison's disease is a disorder that impacts the ability of the adrenal gland to secrete adequate corticosteroids. which can lead to low sodium as well as low glucose levels within the blood. So this particular disorder is pretty difficult to diagnose because it's got very generalized symptoms such as nausea, vomiting, general weakness, and the patient will typically have a strong compulsion to eat salty foods in order to raise that severely inhibited amount of sodium in their blood. On the other hand, Cushing's disease is a syndrome that is characterized by excessive amounts of cortisol secretions, which is commonly caused by a pituitary tumor or in some cases a tumor directly on the gland, which will cause an overproduction of either adrenocorticotropic hormone or the actual hormones themselves from the gland. So this surplus amount of cortisol will inform the body that we are constantly under stress, which can lead to some pretty severe physical changes in the body in order to adapt to the stress. So this will include things like weight gain. So extra adipose will be deposited in order to store energy for that fight or flight. And high levels of cortisol will also lead to higher blood glucose content, which can potentially increase the risk of developing type 2 diabetes, as well as suppressing the immune system, which will increase our risk of sickness or infection. And the only real way to treat this is by going in and surgically removing that tumor to stop the overproduction of either adrenocorticotropic hormone or the actual corticotropics, or corticosteroids rather, from the adrenal gland. Another really important part of the endocrine system is the pancreas, which functions both in the endocrine system as well as in the digestive system as an exocrine organ. And it secretes digestive enzymes to assist in the breakdown of food. And those enzymes are going to travel down through these interlobule tubules and out through here to the duodenum of the intestines to help break down that food. However, these pancreatic islets produce a couple different hormones that regulate a lot of different functions throughout the body and are especially important in regulating blood glucose levels. So let's take a quick look at each of these types of cells and their unique hormones. So first, the primary producers of the pancreas are beta cells, and they make up around 75% of each pancreatic islet. And these are pictured in green, taking up the majority of the space within the islet. So these secrete insulin, which is incredibly important for regulating glucose and how well the body can absorb that glucose. So it's released in response to gastrointestinal hormones like glucose-dependent insulinotropic peptide, which gets released when food enters into the GI tract after we eat. So we're not exactly sure how insulin facilitates the absorption of glucose, but it appears that insulin triggers tyrosine kinase receptors to phosphorylate some cell substrates to speed up the movement of vesicles that are going to take that glucose through the cell membrane and into the cytoplasm to use as fuel. The next most populated type of cells are the alpha cells, pictured in blue here, comprising around 20% of each pancreatic islet, and these produce glucagon, which is the flip side of insulin. So insulin gets released when food enters into the GI tract right after eating, and glucose levels are high, and glucagon is stimulated when fasting, when we don't have food and glucose levels are low. So glucagon is going to stimulate the liver to begin glycogenolysis, where glycogen stores are converted into glucose to be released back into the blood, which is going to increase our blood glucose levels. The liver is also stimulated to begin gluconeogenesis to produce new glucose molecules from free amino acids in the blood. Lastly, glucagon also stimulates lipolysis, where fat stores are going to be catabolically broken down into their component fatty acids and glycerol, and then the liver can take that glycerol and through gluconeogenesis build more glucose molecules. There's a couple more divisions of the islets, including the delta cells and the PP cells. Delta cells secrete the peptide hormone somatostatin, which inhibits the release of both insulin and glucagon. And finally, the PP cells, which comprise around only 1% of each islet, secrete pancreatic polypeptide hormone, or PP hormone, hence the name PP cells, which is released both when fasting and directly following the ingestion of food. And it seems that it reduces food consumption and reduces appetite. There's also these epsilon cells, which secrete ghrelin, which does the exact opposite and stimulates hunger so that we ingest food. Diabetes mellitus is the most well-known disorder of the pancreas, where beta cells do not produce enough, if any, insulin. There's two different types, type 1 and type 2 diabetes. Type 1 is caused by genetic defects typically, and it is only treatable through injectable insulin. There is no cure for it, and without injecting insulin, these individuals simply just cannot absorb any of their glucose, which leads to very elevated levels of glucose in the blood, which can impact kidney function, and can also lead to some sluggish thoughts, and just generally feeling pretty bad, because there's just no energy available from that glucose to actually use. The other variant of this disorder is that type 2 diabetes, which is an acquired disorder, rather something that you are born with. And this comes from different lifestyle choices, such as overeating and a lack of exercise. And this typically can be treated through a diet and exercise regimen, as if the individual can lower their weight and reduce their sugar intake, their pancreas will typically be able to resume its normal functions, and the body cells will be able to absorb glucose properly once again. However, if an individual just does not address the disease and their risk factors, it can progress to a point where the pancreas completely shuts down its production of insulin, and they need to take insulin through injections, much like type 1 diabetics, in order to compensate for that lack of insulin. To finish up our discussion of the major glands of the endocrine system, we're going to briefly touch on the pineal gland, which is pictured right here as part of the brain. It's a little posterior to the thalamus, right under the corpus callosum, towards the back of the brain, situated just a little bit anterior to the cerebellum. So this gland is very small, kind of round and cone-shaped, and it's not very well understood. However, what we do know is that the pinealocyte cells that make up this gland secrete melatonin, which is an amine hormone derived from serotonin, which cues the body to induce a sleep state. It receives inhibiting stimulation from the suprachiasmatic nucleus in the hypothalamus, which means that light stimulation that enters in the eyes, stimulating the optic nerves, will travel back through the brain and activate this nucleus, and that activation of the nucleus will send inhibiting signals to the pineal gland to prevent secretion of melatonin. This means that when light levels start to drop and we get towards the nighttime, the inhibiting signal ceases, and this allows the gland to start secreting its melatonin. And this ensures that we have a proper circadian rhythm that is in sync with the day-night cycle, and we're only sleeping during the nighttime rather than being constantly sleepy during the day, being maybe sleepy during the night, maybe staying up. This helps to just keep a regular sleeping pattern. Interestingly, it seems that children have much higher levels of melatonin, and this may explain why children tend to sleep so much, which promotes their rapid growth and development as people go from an infant all the way up through their adolescence, prepubescent, through puberty. That melatonin level starts to drop off, and we sleep less and less, and the excessive amounts of melatonin may also inhibit the onset of puberty. So as that melatonin production starts to slow down, we start to see the signs of puberty start to develop. So disorders with the pineal gland are relatively uncommon, although they can occur in a few different ways. A pineal gland tumor can cause issues with the production of melatonin, either increasing or decreasing depending on the type of tumor, and this can lead to difficulty sleeping or excessive sleep. And there's also cases where trauma to the brain, such as car accidents or repeated concussions, that trauma can inhibit the ability of the pineal gland to function properly. There's also swelling of the pineal gland, which can be associated with a restriction of cerebrospinal fluid. And if there's not enough cerebrospinal fluid in the brain, This will really negatively impact the brain and cognitive functions. And additionally, a lot of people can kind of get addicted to using melatonin supplements. And they do that to help them sleep, but the excessive use of these supplements can downregulate the pineal gland's secretion of melatonin, which leads people to require the use of melatonin supplements for the remainder of their lives, as the bulk of their internal ability to produce melatonin has been really negatively impacted and even stopped altogether. So far in this presentation, we've covered the majority of the big players of the endocrine system, gone through what hormones they secrete and what the function of those hormones are. However, there is a lot more to the endocrine system than just these handful of glands. There's a number of other organs that, while their main job is not as an endocrine organ, they do assist the endocrine system in producing either their own hormones, the precursors to hormones, or different enzymes to catalyze reactions that convert one type of hormone into another. So briefly, I'm going to go through this really awesome poster that I've been using to help me study for the endocrine system and walk you through as we go through all of these secondary organs and what they do to help the endocrine system. So we're going to zoom in, and I'm going to take you through as we talk about these secondary organs. So first up in our discussion is the heart, situated right there. And the heart produces a hormone called atrial natriuretic peptide, also abbreviated to ANP, and this is produced in response to stretching of the walls of the atrium. This is a peptide hormone that signals to the kidneys to reduce sodium reabsorption and instead pass that excess sodium through the urine, which will reduce blood volume and blood pressure, which will thereby prevent the heart from getting overstretched from too much blood. Then we've got the kidneys right here, and we've briefly discussed their role in the renin-angiotensin-aldosterone system, where the kidneys secrete renin to catalyze the transformation of angiotensinogen into angiotensin 1. Additionally, the kidneys are a part of vitamin D production, and they release calcitriol, and this is the actually activated form of D3, and they release this in response to parathyroid hormone. Lastly, they also produce erythropoietin, which is secreted when oxygen levels in the blood get too low, and this hormone triggers bone marrow to produce more erythrocytes, or red blood cells, and these enhance the ability of the blood to carry more oxygen. The skin, which obviously covers the entire body, is also very important in the production of vitamin D3. The skin, when it gets exposed to UV lights, produces cholecalciferol, which is the inactive form of D3. It has to go through a couple of different steps through the liver and kidneys, as we just discussed, to continue its process to becoming calcitriol, that activated D3. And D3 is really important in regulating calcium absorption through food, as well as for the ability of the immune system to function at its fullest capacity. Next, situated right through here, is the gastrointestinal tract. This includes the stomach, small intestine, as well as the large intestine. And the GI tract will secrete a number of different hormones from endocrine cells that are lodged within the mucosal linings in the stomach as well as the small intestine. These include gastrin, which is a peptide that increases the production of hyaluronic acid when the stomach walls have become distended from food consumption, and this helps to promote the breakdown of food. When this partially digested food, which we call acidic chyme, moves from the stomach into the small intestine, it will produce secretin, which tells the pancreas to release bicarbonate, which will reduce the acidity of the food while also inhibiting the production of more hyaluronic acid. So as we previously discussed, the pancreas is part of the endocrine system in producing insulin and glucagon, but it also is functioning in the digestive system, and one of those functions is the release of bicarbonate. Lastly, the small intestine also produces cholecystokinin, which is another peptide hormone that increases the rate of enzyme secretion from the pancreas, as well as the release of bile from the gallbladder, which will further assist in digestion. So next, right above the heart, is this yellow structure right here, which is called the thymus. And this organ atrophies throughout life, and it's the most active in children. It produces a group of hormones called thymosins, which help T lymphocyte cells of the immune system to develop. And thymosin hormones are also found in a number of tissues throughout the body, although we're not quite sure what their function is beyond developing the immune system. Next, the liver. Right there is another important piece of the endocrine system, and at minimum it produces 4 different hormones or hormone precursors. We've already discussed angiotensinogen. This is secreted from the liver and is one step in the renin-angiotensin-aldosterone system. The liver secretes a couple of different other hormones, such as somatomedin, otherwise known as insulin-like growth factor, and IGF-1 is a primary regulator of overall body growth along with growth hormone. Additionally, the liver secretes hepcidins, which regulate iron balance, and thrombopoietin, which stimulates an increase in blood platelet production. Now we're going to briefly discuss the testes. The testes are obviously a very important component of the reproductive system as well as the endocrine system for males specifically, as testes are one of the primary identifiers of a male. And the testes produce testosterone. This is the primary male hormone. And this causes a lot of the androgenic secondary sex characteristics such as body hair and facial hair, while also promoting higher bone density, increased muscle mass, and testosterone will help the maturation of male gametes, which we call sperm cells. And the testes will also secrete a hormone called inhibin, which inhibits follicle-stimulating hormone from the anterior pituitary, which we've discussed before. And this effectively reduces the level of spermatogenesis in the testes. Testosterone is also produced in female ovaries, although this is in much smaller quantities. The main secretion of the female ovaries are estrogens. So the ovaries are right here. And the main secretion of the ovaries are estrogens, and these are the main female hormones that give rise to female secondary sex characteristics. These include things like the deposition of adipose as breast tissue, and estrogens are also very important for the regulation of ovulation for females. Additionally, the placenta is a temporary female organ, and this is only existing while a female is pregnant, and this is an organ that provides nutrients to the growing fetus while producing a couple of other hormones to ensure a healthy pregnancy. So we're going to come back up here. So when the placenta is actually present, it's going to be right here, developing around the vaginal area. And this is only temporary while a woman is pregnant, and it produces a number of hormones such as human chorionic gonadotropin. And this increases the production of progesterone, which is one of those hormones that maintains menstrual cycles, and it also produces a hormone called human placental lactogen. and this is something that will prepare the breasts and mammary glands for the production of milk. Lastly, there is relaxin, which is something that appears to help soften and widen the pubic symphysis, which permits a baby to pass through the pelvis, which is typically very difficult. There's really not as much space as there needs to be for a baby to pass through, so relaxin allows that symphysis to widen out a little bit and promote the birthing process to occur a little more easily. Finally, adipose tissue and osseous tissues are scattered throughout the body. You've got bones in your arms, the ribs, the spine. Bones are obviously everywhere, as well as adipose tissue, both under the skin, in between different organs, providing cushion and joints. Adipose tissue secretes two different hormones. One is leptin, which signals the brain that satiety has been achieved and to cease eating, and adiponectin, which reduces insulin resistance, allowing insulin to promote the absorption of glucose. Meanwhile, osseous tissue that makes up the skeleton produces an additional two hormones. Fibroblast growth factor number 23 is produced when levels of vitamin D3 or levels of phosphates have become excessively high, and it will inhibit the ability of the kidneys to create calcitriol, as well as instruct the kidneys to pass the excess phosphate or excess vitamin D3 through the urine. It also produces osteocalcin, which increases the proliferation of osteoblasts, which thus increases bone mass and bone density, and it also instructs the beta cells of the pancreas to produce more insulin. So that wraps up our discussion of the endocrine system. We've gone through a lot of the main glands and their hormones, as well as a lot of the secondary glands and their hormones, as well as how they help to assist the rest of the body in its growth and development, and how it assists the rest of the endocrine system to do everything that it needs to do. There's a lot of interplay between different systems, as all of these systems need to be in constant communication in order to properly function as a full human, in order for full growth and development of the nervous system, of the muscle system, the bone system. Everything all needs to tie back into each other. And through hormones, the brain, the hypothalamus, the pituitary is all able to stay in communication, and everything reacts to one another through negative feedback. So as the body goes through changes, different hormones will be released, and this will alter the balance of different compounds, different minerals, nutrients, inform the body how much fat there is, that we need more fat or we need less fat to keep eating or stop eating. Will help to prepare the female body for pregnancy, support that pregnancy, and ensure the healthy birth of a new child, and many other functions. And so clearly we can see that the endocrine system is really vastly important in the full function of a human being.